It's my top 3 tips for great skincare for that special day. Thanks very much for watching. Hello and welcome to a much shorter version of this week's newsletter from Vysana Life. Hi, I'm Dr. Sunny Dhesi, GP and aesthetic doctor, and also developing women's health specialist. So it's shorter this week because it's half term and it's always a priority to spend time on oneself and with family. But equally, I didn't want to neglect my newsletter duties. So what do I have in store for you this week? It's a short one, and it's more based on what there has been more questions about this week. And it's it's in relation to a lot of questions about skincare, especially leading up to big events. Now, we have had lots and lots of questions from brides-to-be who have experienced problems with their skin. So if you carry on watching, it's my top 3 tips for great skincare for that special day. Thanks very much for watching. So skincare tips, 3 skincare tips for that big event, that big day that's coming, especially for those brides-to-be, stressing about skin, breakouts, congestion, dry skin, itchy skin, dehydrated skin, name it. We've had all the questions this week about it. So tip number 1 is calm down on that exfoliation. So a lot of patients who we've spoken to have been using salicylic-based cleansers because they help to reduce inflammation and they help with congestion, especially congestion around what we call the pilosebaceous gland. So that's around hair follicles. Not that for most women that you have visible hair, but those tiny little hairs that are on the skin can sometimes, the follicles around them can get congested, leading to spots or buildup of inflammation and congestion. And that can lead to those dreaded spots. And for those of us with darker skin, what can then happen is you get what we call a post-inflammatory hyperpigmentation. So you get an inflammatory process going on and some pigmentation that almost looks like a spot, but takes ages to clear. So the first step is have a look at your cleansers. What you should really be doing is almost having a 70-30 split with the type of cleanser that you're using. I would suggest 70% of the time you're using a cream-based cleanser. I would definitely advocate something like the Illumier Sensicalm. It's a cream-based cleanser, not much actives in there. And then for the remainder of the time, maybe 2 to 3 times per week, probably at night time, is use your kind of salicylic-based cleanser. Again, Illumier have a acne clarifying cleanser, but most people are using either a Paula's Choice or other brands are out there. But basically what I'm saying is try and keep it to a 70-30 split. Don't be cleansing with a exfoliating cleanser on a twice daily basis. It disrupts the skin barrier function, it increases transepidermal water loss, which then can lead to breakouts and inflammation. So that's tip number 1. Tip number 2 is to look at lifestyle choices. So definitely try and reduce alcohol intake. Now, many patients that I know don't actually consume that much alcohol, but there is no safe limit. There is no sort of minimal level. So I would say leading up to any big event, especially when you want your skin to be looking at its best, is avoid all alcohol. And the reason for that is because the alcohol causes dehydration. It triggers dehydration, and it can also have that effect on the skin. Plus, alcohol has a lot of empty calories in there, and this can also add to weight gain, especially if you're drinking sort of regularly. So I'd say definitely tip number 2 that I've noticed from looking at what patients' lifestyle choices are is definitely avoid alcohol. On that same basis about diet, definitely increase the intake of oily fish. Definitely increase your sources of vitamin D, even if the weather has improved. Most of us are still deficient or insufficient in vitamin D. And collagen, a bit of a tenuous one, I always talk about it, but again, I would definitely consider taking a collagen supplement, especially because we don't get enough in our diet. So that's tip number 2. Definitely avoid alcohol, increase things like oily fish in your diet, increase your sources of vitamin D, and definitely try and increase your source of collagen. Over the next 4 weeks, that will start to manifest in terms of better skin cell or more efficient skin cell, or whichever way you want to look at it in terms of layman's point of view, is definitely better turnover of skin. And that's tip number 2. So tip number 3 centers around the mantra that we have here in clinic, which is mindfulness, menopause, and medicine. So Mindfulness is something that we often neglect. Now, it is a stressful time. You've got lots to organize if you're getting married, or if you're helping support someone who's getting married, or just there's big events coming up. Some of our patients have award ceremonies to go to, or work events to go to, or they're going on holiday, and that's a big event in itself. You want to be looking your best. So practicing active mindfulness really does make a difference. We see that difference, for example, when we measure patients' blood pressure. They first come in and the blood pressure is quite high. I get them to practice a little bit of mindfulness, relaxing, breathing exercises, and their blood pressure drops. So there is a definite mind-body connection when it comes to different organ systems, and that's not to say that skin is not one of those. So if you are try and wake up maybe 30 minutes earlier than you normally would. I would go about your daily routine. So for example, go and brush your teeth, go to the bathroom, and then take that extra 30 minutes to just sit down. One of the techniques that is very, very useful is, if you're not doing exercise, which I'd always advocate as well, is close your eyes and start from 100 and count backwards, trying to visualize the numbers as you do it. As you count down from 100, you'll find that if your mind is a little bit chaotic and unfocused, you'll stutter and you'll struggle to get past that sort of set numbers. Then you restart and you continue doing that until you get to 0. And when you do reach 0, your brain is in a much more relaxed state. It's been distracted by focusing on counting down. So that is it for this week. This is a short one. I hope you've enjoyed watching. That was tip number 3. It's always mindfulness, menopause, and medicine. We are very much focused on women's health, but we also do focus on men's health as well, because it's yin and yang. Without one, you don't have the other. I'm Dr. Sunny Dhesi. This is Vysana Life, and thank you very so much for watching. If you haven't already tuned in, if you haven't already subscribed to the YouTube channel, please do. We always welcome comments and feedback. If you found this useful, then please do drop a comment. If you haven't found it useful, please drop a comment as well. So once again, I look forward to sharing a longer newsletter with you soon. But this is me signing out, Dr. Sunny Dhesi, and this is Vysana Life.